So today we're going to do a hysterectomy on a menopausal lady that has prolapse. Basically, the average woman in Mali has 7 to 8 children, and she's had 9. And as a result of that, her internal organs are kind of starting to fall out. And so when she walks, she's walking with her organs between her legs, and it's very uncomfortable. So it's a very common problem here. So we'll do a hysterectomy and take her uterus out, and then we'll fix the cervix and the top of the vagina. We'll attach them to the inside of her sacrum, of her tailbone, kind of above the tailbone there, and try to fix it back into its anatomic place so that she can walk and lift and work and carry on her normal life without having all these organs falling out. So it's a reasonably common case. We probably do 4 or 5 of this surgery each month. It's a common problem. So yeah, one of the joys of being out here is we get to receive visiting medical teams from America, and we have a team with us from Grand Prairie, Canada, Alberta, Canada, and there's a team of 4 or 5 people with us here. And so Dr. Drew is a gynecologist, and Dr. Anna is a general practitioner, and they'll be with us for 2 weeks. And this year we'll probably do about 450 surgeries, average a little more than 1 a day. Probably 1/3 of those are cesareans. Our cesarean section rate is about 7% of our deliveries, and we average 150 or 160 deliveries a month. The majority of the rest of our surgeries are gynecologic in nature. Most of them pelvic masses or hysterectomies, things of that nature, and then occasionally we have general surgery, just emergent patients that come in with a surgical emergency, and we do our best to take care of those.